Hello, my name is Mykaela.
And I'm Lauren, and we are women's health nurse practitioner students at Carlow University in Pittsburgh, Pennsylvania.
We are doing a research project, or to us, capstone project, on the knowledge of sexually transmitted infections, STIs, among college students. Specifically, we're conducting our research at IUP. Uh, we are here today to give you basically a brief introduction on STIs. STIs are very, very common among college students. About 1 in 5 college students get an STI.
The most common sexually transmitted infection in the United States is human papillomavirus, or most people know it as HPV. Other STIs are gonorrhea, trich, chlamydia, syphilis, genital herpes, hepatitis B, and HIV. An STI is the infection you get from one person to another when having vaginal, oral, or anal sex. They are spread through bodily fluids like blood, semen, vaginal secretions, and even skin-to-skin contact.
You may not even know you have an STI because majority of them are asymptomatic or without symptoms. Possible symptoms, if you do have any, are pain with urination or sex, unusual discharge from the penis or vagina, sores, blisters, or warts on the mouth, genitals, or anus, itching, burning, or pain on the genitals. It's very important to get tested yearly and in between sexual partners, even if you do not have any symptoms. There are many facilities around that actually offer free testing. The good news is if you do test positive for an STI, some are treatable, and those that are not are usually well managed with medications. Though best practice is preventative, since many STIs can come with complications. When getting treated for STIs, it's important to finish the full course of medication that you're prescribed. That's what it takes to treat the infection. And not to have any unprotected intercourse, or really you should avoid intercourse altogether with anyone else while getting treatment, because you can actually reinfect your partner or infect someone entirely new if you aren't fully cured.
Yeah, so it's also great practice to get follow-up testing for those curable STIs, and your doctor is going to call them test of cure. These curable STIs are chlamydia, gonorrhea, and trich. And this is done about 4 weeks after treatment is finished. Complications of untreated STIs are pelvic inflammatory disease, infertility, ectopic pregnancy, chronic pelvic pain, increased risk for cancers, organ damage, neurological complications, and an increased risk for HIV.
You can help reduce your risk for getting an infection by correctly using condoms, getting vaccinated against HPV, that's the Gardasil vaccine, and getting vaccinated against Hep B, getting tested when symptomatic or after waiting the appropriate time for an STI to become detectable, and getting tested early. Also, have important open communication with whoever you're being sexually active with on when you've last been tested and your current STI status.
Yeah, and we have a pamphlet that you can download and print out for reference if you have more questions. We go into more detail on that. And also visit your healthcare provider to get more information.
Thank you so much for watching, guys. Please proceed to the post test, and thank you so much for your time.
Yay! Bye.